Okay, so welcome. Thank you for joining me to learn about our upcoming 6-week yoga therapy for chronic pain program. So this program is for people who are living with persisting or chronic pain and want to learn how to move better and to ultimately live better and to regain mobility and strength and gain some knowledge around how to regulate their nervous system and calm down the pain signals. So a bit about me before I dive in a little deeper. I'm Carrie. I'm a certified yoga therapist that work primarily with people living with chronic pain and people recovering from trauma. I've been teaching yoga for about 15 years and have taken a lot of additional training in and around chronic pain, primarily with Neil Pearson. And I'm passionate about doing this work because I myself have had a journey with chronic pain and trauma. And I've been where you may be, where you've tried everything and can't seem to find the support that you need and see changes or improvements in your pain, your mobility, your strength. And so for myself, when I found yoga, I started to see some changes in my stress level, as well as my strength and my ability to regulate my emotions and my nervous system. And I was not requiring as many frequent visits to healthcare practitioners. So we'll talk a little bit about pain before we go into what we're going to be expecting through this program, and there'll be time at the end for questions. You can always email me as well if you have additional questions. So first off, pain is pretty complex and it is unique for each of us. Some of us experience it in movement, some at rest, and it is based on a lot of factors. It's based on past experience, injuries, life that has happened to us. It's also to do with future worries and things like emotions, sleep. There are many factors that can affect our pain. Some of us have tendency to be pushers, so we push through the pain. I'll say that's probably a lot of us here. And there are some of us that are also have some fear around movement, fear about injuring ourselves more or damaging our bodies. And that is common, and sometimes we're a combination of the two. And in this program, we're going to learn how to gain better awareness around our tendencies and how we are able to make some changes to support ourselves. So we do this through many different layers. So it is not just a light switch that we turn on and everything is okay. It is really a multi-layered approach. We start with elements like awareness, gaining awareness around sensations in our body, the good stuff and the challenging stuff, getting to know how our body protects ourselves in different forms. And usually one of those main protective mechanisms is pain, but there are a lot of other factors that tend to kick in when we are protecting ourselves. And that can also be breath holding, body tension. It can also be thoughts that are negative or going down that rabbit hole. And so the good news is that all of those aspects are changeable. We have influence over those things. With practice and tools, we can learn how to change our pain. So pain care yoga or yoga therapy for chronic pain, we're going to be exploring pain science, and that is how we gain an understanding of how pain works, what's really happening within the systems, especially as it changes from an acute injury into more of a persisting or chronic pain. Getting to know our alarm systems, our protective mechanisms, gaining awareness around what's really happening in our body, in our minds, in our heart, And when we have that awareness and the science behind it, we can make better choices to support ourselves. Awareness is where we start. Pain education is an important component as well. And then we'll spend a lot of time practicing regulation techniques. And this is where you change stuff. This is where you change your breathing, where you try and release the muscle tension. It's where you move your body in ways that feel good as you breathe to start to regulate. We spend some time learning the pain care movement guidelines. And these guidelines help us make informed decisions about how to safely move our bodies. So when you feel that first increase in pain, it's not tissue damage. It is a warning. It's telling you something needs to change here. So we want to learn how to move towards those increases in sensation. And then we follow some steps from there. We check in with our breathing, our muscle tension. We ask ourselves questions like, are we safe here? If the answer is no, of course we don't continue. We pause, we change the range of motion. If we ask ourselves that question, I'm feeling an increase in pain, however, I am safe to continue, I know I'm not going to hurt myself, then we find ways to move safely as we keep our breath calm and our tension low. So we'll have, I don't expect you to remember that all, and it takes a whole lot of practice, and we will repeat every week on how to practice these. Every movement practice that I guide you through, we will be moving using these guidelines. You will receive handouts that have these guidelines on them, and these are steps to follow around awareness. So awareness is noticing what's actually happening, what's going on in my body with my breath, with my thoughts. And then from there, we move into regulating. We want to try and regulate the breath, the body tension, move in ways that feel safe. So we're using our movement guidelines to get good information about what do we do now? How do we move safely? So a little bit about how this yoga program is different from seeing other healthcare practitioners. And so many of you will be in treatment of some form or will have experienced it in the past. And this program and yoga is not intended to replace that. It is intended to be complementary. So continue seeing your practitioners and add this layer that is hopefully only going to bring you more relief and more information and knowledge and tools to empower you. So a little bit about what to expect in the sessions. So each session will be a little bit different, but it will have the similar format. We'll always start with a centering or a grounding where we'll arrive, we'll settle in, we'll do a check-in and notice how we're doing. We'll move into a little bit of information and pain science education. And then we'll start to move into the practices and the tools and exploring them. And often we'll start with awareness, which is where we check in and notice what's happening. And then we'll move into a form of regulation. And sometimes that's breathing practices, sometimes it's movement, sometimes it's both. We will have time also to check in and have conversation around how things are going and ask questions and share our learnings and our life experience that may help others if you choose to. So of course that is optional. You'll be getting an email with information about what to expect each week, along with a follow-up and a recap of what we have practiced. Often there will be recordings, so whether they're audio or video recordings of the practices The video element will always be of just myself, as well as the audio, and I will be posting that in a shared drive for all of the participants to access. So you can go there and use them as you want to. And that is the intention, is that we practice often. It's, these tools and practices are not one and done. They are to be practiced and embodied over time. You can think of it as a new job or a new sport where we are learning to reprogram our body and our nervous system to regulate, to start to dim some of the pain signals so that we can move better. And some of the classes will have more movement and some will be more gentle. And it also often depends on the group of people that are together. Sometimes there will be, or often I should say, there will be people practicing different ways. Sometimes we'll be lying down, others might choose to be seated. Some people will choose to take the class from home or just catch up on the recording. With finding ways to change our pain, we need a multi-layered approach. So what I mean by that is we need to spend time resting so that the neurons and the nervous system has time to incorporate what you're practicing. We also need time for regulation, where we're breathing and regulating the nervous system. And we need time for challenge. So we need to challenge the tissues in order for them to get stronger and healthier. And we'll do that safely through guidance, and you will always be met where you are. So whether you have knee injury or back challenges or neck issues or a condition like fibromyalgia or chronic fatigue, this is not intended to be for one specific challenge or area of the body. We often have a very diverse group, which is wonderful, but the principles that we apply, the pain care guidelines, can support all of us as we're going through this. When we do move our bodies, there will be lots of options and modifications. So, for example, if you have a range of motion that stops here, that's okay. Maybe you move the other arm differently, or you'll be offered different variations. If it doesn't feel safe to move your body in any way, you can always pause and shift into visualization. Visualization can be just as powerful in seeing change in the tissues. And so we can think of movement as medicine in any form. Sometimes it's as little as opening and closing the hands as we breathe. Sometimes it's finding challenge, coming into a stronger shape like a chair pose, or moving through our spine in our cat-cow. But movement is medicine. So a few other things to mention before we try out a few practices is what to bring to class. So if you're taking the class in studio, we have lots of props here, and props are things like our pillows and our blocks. We have lots of blankets here. We can also have chairs available, especially if we know in advance. If you're taking the practice from home, you're going to set yourself up in a space that feels good for you. You'll wear comfortable clothes, have some water with you. Because you will be receiving handouts, you are also welcome to make notes if you want to. And I don't want to call it homework, but you will receive some practices that you could try on. And so, as I mentioned before, the more you practice, the better it gets. So we are going to try a few practices now. And we're going to start with an awareness practice. And so why we often start with awareness is because for many of us, what happens, we feel some pain, we then feel like we need to fix it. We need to change something right away. But sometimes when we can spend a little bit more time observing what's present, what's happening, we can gain more insight and information. And sometimes in a practice that is just around awareness, we can feel some release, some ease. And then we'll move into a little bit of regulation. So if you want to try it out, you're going to come into a comfortable shape. Comfortable, of course, is relative. So you might choose to lay down, you can sit against a wall, you could be standing if you want to. So you'll just let your breath flow at a natural pace, the way that it wants to, and start to bring all of your awareness to your body. Become aware of the breath, breathing your body. And now start to divide your attention between your awareness of your body and your awareness of your breath. And notice where you feel movement as you breathe in and as you breathe out. Just start to explore. Now we'll take our attention all the way down to our feet. Continue to breathe in and breathe out. And we're going to scan the body from the feet, moving our awareness up slowly. Just noticing what sensations are present. You might notice discomfort or tension. You might notice areas that feel spacious and light. Just check around, moving your attention all the way up. And then once you get to the top of your head, start to move your awareness back down, just noticing what is present right now. What's calling your attention without labeling it good or bad. Just observing what's happening. And you can let that practice go whenever you're ready. You may have noticed areas that you were already aware of. And this is just an example of a very short practice. Maybe something surprised you as well. And so now what we'll do is we're going to move from awareness, noticing, to now regulation, where we're going to start to change things. So awareness, we're still present. We're still bringing the focus to the body. We're now going to bring the focus to our breath. So if you need to change positions, do that. And start to shift your awareness now towards your breath. And now as you hold your attention on your breath, see if you're able to let the next breath in become just a little bit longer. Breathing in through the nose. And as you breathe out from the nose or the mouth, let the breath be longer. Keep your awareness on the breath. Breathing in a slightly longer breath. And exhaling just a bit longer. Breathing in like you're taking in your favorite scent, longer breath in, and exhaling from the nose or the mouth. Let it be longer. Letting one breath at a time become just a bit longer. Now see if you're able to not only let the breath be longer, but let it be smoother as well. Like you're smoothing out the waves on the ocean or on the lake. The breath is just a bit longer, just a bit smoother as you breathe in and as you breathe out. And if you're doing okay with a longer, smoother breath, you could add softer as well. Like you're softening a tight muscle, the breath is becoming softer. So a longer, smoother breath in and a longer, smoother breath out. Slow and steady. So regulating the breath, finding a longer breath is calming for the nervous system. It's not about your biggest, deepest breath. It's a long, smooth breath. And that type of a practice on its own can help begin to shift. Now, those are two elements, awareness, regulation. When we get into movement, we'll be moving, for the most part, we'll be moving with our breath. Because we know that when we hold our breath, that increases things like pain and tension. So we're going to always try our best to breathe and use our breath as a guide as it relates to how much we move or how far we go. So we'll try moving together. I'm going to slide back a little bit so that you can see me a bit better. So first thing we want to think about if we're exploring these movement guidelines is as you're moving, if you feel an increase in tension, pain, or breath holding, check in. Use that as a warning sign, like a yield sign, and ask yourself, am I safe to continue? And if the answer is no, you're going to change the range of motion or pause. If the answer is, okay, I think I can stay with this, then I want you to try and keep breathing, try and soften the tension and move in a way that feels good for you today. So we'll start with the shoulders up and down. If this is an area of sensitivity, just do a really small movement. Focus more on the breathing. So the breath in, the shoulders will come up to the degree that feels safe. And then the breath out, we soften the shoulders. Maybe as you go, you find you can move more. Maybe you make this a little stronger. This is also a good practice for releasing tension. And then when you feel like, okay, that's enough, let your shoulders come down and we're going to reach our arms up. So if you could be doing this seated or lying down or from standing, you can choose to raise your arms laterally or forward in a V shape, nice and spacious. And you decide how high up you reach. We're going to breathe in to reach up and we're going to breathe out to reach down. So again, you decide, are you safe? Can you keep your breath calm? Can you keep the tension low? So when you're ready, breathing in, reaching up, you can make this soft or strong. If you want to look up, you can. And then as you exhale, bring the arms down. You can also look down if you want to. Breathing in, find a range of motion that's safe to explore. And breathing out. Good. One more like this. You can pause at any time. Good. Just let the hands rest. Circle out the shoulders if you want to. And now we're going to move in some rotation. So notice as I say that, if there are any thoughts that come up, maybe twisting is an area that doesn't feel safe in your body, you can always come to visualize. So you can put your hands on opposite elbows, upper arms, or shoulders. Breathing in here, relax your shoulders, sit up nice and tall, and as you exhale, turn as much as you want to. And then come back to center, breathing in. And as you exhale, find your range of motion. Maybe you move to an edge of challenge today. You go a little further, get the muscles really firing. You decide. Maybe today is a softer day. Maybe you need less. And then when that feels like enough, you can come back to center. Either find stillness or move your body in a way that feels good. Sometimes circling, or if you want to take cat-cow where you're rounding and extending, just take a few moments. Find something that feels good in your body. So those are just a few examples of some of the practices that we would do in a session. So there'll always be an element of awareness, of regulation, and movement. Some days there will be more challenge, some days it will be more rest, and that's because we need a combination of all of those elements in order to influence our pain. So just a few reminders to wrap up before I take questions. This program is at Vayusha Yoga in South Surrey, but it can be taken virtually. So you can be taking it from anywhere. It is going to be on Tuesdays at 4:30 for an hour, starting on September 30th. And all sessions are going to be recorded. So if you can't make it to all of them and you know that already, that's okay. You can catch up on the recordings. You will also have those as a reference for afterwards. And what we're going to be learning is how we can move our body safely when we have pain, the movement and breath practices that are helpful for calming the nervous system and reducing our pain. We're going to spend some time going over pain science education to help empower you with knowledge about chronic pain. You'll gain skills to reduce your fear around movement, or if you're on the other end and you're a pusher, gaining skills on learning how to dial it back so that you can safely explore your body, and you'll have me to guide you along the way. And we will also use some of the yoga philosophy tools and practice mindfulness and compassion. Elements like the yamas and niyamas, important ones like ahimsa, which means non-harming. And when we say that, we mean non-harming in the way that we move our bodies, the way that we speak to ourselves, what we put into them, how much rest we get. Practicing self-compassion can also be a really important element. And we're going to learn how to apply these practices and tools into our daily life. And we'll start creating a treatment plan so that you can follow it on your own. So you have something tangible to work from, because it can be overwhelming when we move from sessions together to trying to do this on your own. And it's a great opportunity to build community and relationship with other like-minded people. So I hope to see you, or if you're curious and want to learn more after this session, you can always reach out and email. I'm going to pause the recording now and see if there are any questions. And you will also be sent a copy of this recording